for school for a long, I went to school for a long time to study, and I have fascination with neuroscience and also psychology. So I did training in the UCs and ended up in geriatric psychiatry. And so I'm currently the director, clinical and research director of the Pacific Brain Health Center in Santa Monica, which is affiliated with the Providence St. John's Health Center. I'm happy to join with you all today and go over something that's basically the center and the focus of what I do at work, which is help people reduce their risk of developing Alzheimer's disease in later life. And the way that we approach this is through a personalized medicine approach and optimizing each individual's healthy lifestyle behaviors. So just have to say as an aside, it's been fantastic to work with Allison and with the affiliated psychotherapists of various sorts during the pandemic. And my goal today is to help empower you and enliven you to carry on. And I think we really need to be champions of this cause to really reduce people's dementia risk as they're getting older. So a couple disclosures and talking about off-label use. I don't have any disclosures to disclose. I will discuss consideration of off-label use of hormone therapy for older adults for dementia prevention. So I did just want to mention that, that's not on label, that's kind of off label. And a few learning objectives. I would like us to leave today better understanding having the information at hand. We all know what's good for us, but knowing what is the role of physical exercise for prevention of dementia kind of physiologically. Similarly, review preclinical and clinical evidence for the role of diet for dementia prevention. And then kind of getting more medical, the role of blood pressure risk and dementia risk. And then kind of finish out and round out to give you a framework of kind of the top dozen lifestyle factors that we know contribute to dementia risk. So when you join with clients and you talk with families, that as these 12 topics come up, you can say, and you know what, like doctors agree with you, and there's an evidence base for that. And that's absolutely the right idea, that you should have an air purifier, or you should walk outside when it's not smoky or cloudy. Anyway, so we'll review that. And why? So the overarching framework, the goal, I was so excited last night because I was thinking to myself, okay, how do I drive home the point that the reason we all go through this for ourselves, each other's, our clients, is to not just live longer, but to live healthier. And so there's this very useful concept of the health span versus the lifespan. And our goals here are to decrease the time that we're living with severe or serious age-related disorders such as Alzheimer's disease. So how do we increase our health span while we're also living long? And so we end up with optimal longevity. That's my take-home goal at the end of the day. And I focus on the brain because it sits on top of the body and kind of are what you eat and you are what you think. So the mind-brain coming together. So how do we increase health span via optimization of our brains to kind of avoid the risk or minimize or mitigate the chances that we will progress over time from from a healthy older adult stage, or if we're at risk from a pre-dementia state, how do we kind of try to hedge our bet so we don't end up dealing with our loved ones, our clients, dealing with a serious mild, moderate, or severe dementia due to Alzheimer's, where the memory loss symptoms are interfering with our everyday activities of all sorts, and we're increasingly dependent on care partners or caregivers. How do we intervene to lessen the odds of that happening, and why would we do that? The goal is to preserve cognitive function with aging, and we now know that the earlier we start, the better odds there are through preventive measures to protect the brain, the better the odds are to have better outcomes of cognitive function over time. So last night I was very excited because we've known about these factors for a long time, but I was looking for the evidence base, like, okay, what sums it up? Is there evidence that all these behaviors throughout the lifespan, from being a toddler to young adult to middle-aged, older adult, not smoking, not drinking excessively, eating healthy, exercising, treating things like blood pressure and lipid problems, is there evidence that this actually moves the needle, that it actually helps prevent Alzheimer's? And I came to this, there's absolutely evidence. And if healthy lifestyle were a drug, we would literally give it to every patient. It's speaking as a prescribing doctor, but it's not. So we reliant on ourselves, each other, to kind of champion this evidence together and speak in a way that convinces people to not just contemplate of it, but to, when they're ambivalent about whether or not to take action to change their behavior, that you give them the evidence to then take action. And when they're ready for action, that you give them the pragmatic tools. Like for me, I'm like, oh, I've got the cognitive care solutions group. I'm going to connect you with a therapist who's aware of this and savvy. And like, you guys are going to start working on this week in, week out, of like how to meet these goals of eating a Mediterranean style diet, having cognitively stimulating structured activities throughout the week that are social, exercising regularly so you meet these exercise goals. And so last night, I was looking up studies, and just April 13th, it was published in a prospective cohort study of 2,500 men and women age 65 plus, that when they look at life expectancy, meaning number of years lived, and how many of those years are lived without Alzheimer's, the number of healthy lifestyle habits that these participants reported related to or predicted living longer and living without Alzheimer's for longer. And so you basically, if you remember, I think it was slide 3. Nope, that's my disclosures. If you remember this slide, we're trying to get the blue bar to be longer and less of the red bar. This study changed the color scheme, but their outcome figure is basically proving this point in terms of a study. So I was like, oh my God, this is the study. So like participants, it's a little common. Let me talk a little bit. So women are represented on the left half of each figure. Men are represented on the right of each figure. Everybody with me so far? I can see Allison, Tina, and Carrie. Are you guys with me so far? Okay, good. Sorry, I can't see everybody, but so women and men are represented as on the bars, and the number of years that participants lived, which is represented both in purple and then in yellowish for me, is represented on each line. So at the bottom, you have people who lived the longest, and at the top, people who didn't live that long. If it's yellow, they had dementia or Alzheimer's. If it's purple, they were healthy. And so the kind of pyramid on the left is people with 0 or 1 healthy factor, which is diet, exercise, cognitive stim, not smoking, no excessive drinking. People who only did one of those things. So they were either smoking or drinking or not exercising. They clearly, just visually, they're not living as long, and they're having more years with Alzheimer's. So they're having more of this red zone living where they're not having optimal longevity. People with 4 or 5 health factors, boom, significantly, like some people 20 years of healthy living. This doesn't even involve precision medicine. This is just basically self-report. So I'm like, wow, this is hot off the press. This is April 2022. You might see it on CNN. You might just see it in your therapy sessions. You might just bring it up. So there is evidence out here all the time to help you persuasive. I was excited by this. I'm excitable. Anyways, so now I just wanted to take a breath. Allison, let me ask you, Allison, what time can I finish so we'll have some time for some questions and answers? Because that's very much, I have a hard stop at 1 p.m. because I run a Zoom group, which I'll talk about. But can I finish by like 12:40 or 12:45 to have Q&A? Or?
Of course.
Okay, that works. So I'll try to aim for kind of like 12:40, 12:45. So we can go to, I can go till 1. Everybody good to go till 1? More or less?
Yes, of course, yes.
Great. Okay, great.
That's great.
So now we already showed you the evidence. I could skip ahead. I mean, I'd be happy to stop now, but let me walk you through some of the other evidences. So when you're having these discussions, and Allison, please do get me to send you these slides. You're welcome to share them with any attendants. It's kind of public knowledge stuff. It's fine.
Oh, awesome.
This helps give
Thank
you
you.
the evidence base.
Excellent.
So as far back as pre-pandemic, like way back 2017, national academies reported that at least 3 factors have significant evidence to recommend for dementia prevention: blood pressure control, physical activity, cognitive stimulation. Somebody should make a group, cognitive care solutions, yay. So somebody was thinking ahead. So back in 2013, I was studying with a group in UCLA Longevity Center. We had a cohort study. Our cohort didn't have 2,500. We had about 150 or so. And we were looking at, does blood pressure relate to memory and pre-dementia? It turns out those with the lower blood pressures, which is the green bars, it's pretty, like you can tell this from across the room. The green bars represent better cognitive performance. Those with lower blood pressures did better on all our memory testing across every cognitive domain: executive function, language, memory, visual, spatial attention. So when somebody goes to the doctor, they have 160 over 100, and you're like, oh my, that's not good. It might be stress from the doctor's office, but when they're checking at home, if you have persistent high blood pressure, that really puts you at risk for non-optimal aging. So I know it's very conventional, it's very primary care, it's like not functional medicine, woo-woo, but it is very important that people manage their blood pressures throughout life to try to get to one of these brain health targets of like 120 over 80. You may not get there overnight, but eventually, yes, I also have a 1 p.m. Okay, so it's targets your blood pressure, and that actually relates to better cognitive outcomes. Was that? Remember, we're kind of going over what's some of the evidence for these 3 factors that the National Academies have said, please do confidently recommend this in your clinical care for cases. So control blood pressure, be physically active. The brain effect of physical activity is largely happening in the memory centers. The hippocampal formation is key for forming new memories of events and narratives of goings on. This is what's very hard, very robbing about Alzheimer's. People have rapid forgetting. They can't encode, they can't learn something new. Sometimes the horse is out of the barn, it's too far into disease, you can't form new memories, but we try. Physical activity at any point, this is in pre-dementia again. We stratified our cohort into lower physical activity, higher physical activity. We're able to measure the brain impact of regularly having higher physical activity. You have thicker brain, you have more memory center to work. And what's a target? Moderate exercise, aerobic 5 times a week, about 30 minutes per session. Strength training twice a week. Strength training, underrated, very important. Builds the muscles, builds the mind. There's some more evidence for you. Not only does it have a brain effect, it also has a cognitive outcome effect. So again, the goal, the optimal higher activity group is having better memory performances. The lower activity group is having worser performances. So similar to the blood pressure story. And the effects are not just brain and cognitive. We also see mental health benefits to physical exercise. I'm probably preaching to the choir in many ways because we're all quite aware of this. So I'm not going to dwell on it in the interest of time. But we've done other studies in different populations, and even in professionals who are at work, you do workplace wellness programs when they're intense enough, you do get physical and mental health benefits. And then what happens when you start combining these things? So just like the epidemiology study showed that 4 or 5 healthy strategies, you're living longer without dementia. When you add memory training and exercise, you get a synergy. So it's good to do brain training. It's good to do memory care, cognitive strategies. Can we juice it? So we did a study starting back in 2018. This is ongoing now. We have a second pilot trial going where when you're combining memory training and physical exercise, there are synergistic effects. And these effect size represented by the blue bars are actually larger effects statistically than sugar pill, thank goodness, larger effects than prescription medication, things like donepezil, memantine, huperzine is a supplement version of that. Anyways, the exercise with the synergistic training is actually larger effect size as measured by Cohen-D than either medications for memory that are available, cognitive exercises that are available, physical exercise training, which has been shown. The money is really in combining things, making synergies. And that can be through gamification. It can be through doing group trainings with a fitness trainer who knows about memory training. You can do it with your partner, your spouse. You can do it with your dog. I mean, if you're doing the things. Anyways, this has been studied. We understand molecularly that this is not just the psychological lift, this is also brain physiology. So there's something called brain-derived neurotrophic factor that when lab animals are given more stimulating, enriching environments, something called brain-derived neurotrophic factor, or BDNF, is increased in the expression level when they're given novel stimulation throughout the day, throughout the weeks and months. And the increase in BDNF is also triggering preservation of neuronal cells, more synapses, birth of more new brain cells in the older adult brain. So the hippocampus, the memory center I talked about, has something called neurogenesis, which is increased by physical exercise, and the brain cells survive when you have cognitive stimulation around the time that the cells are born. So this is the idea. You get clients moving, you get clients thinking, you get clients having their brains becoming more plastic again like they were when they're younger. And you end up hopefully with a better functioning brain. And to boot, there's emerging evidence that we might also be lowering the pathology burden. For Alzheimer's, the hallmark pathology is plaques and tangles, amyloid plaques, tau tangles. And there again, so it's both kind of improving the brain structure and function, and then also decreasing your pathology burden. So pathology marked by amyloid plaques and tau tangles. This was a series of studies we did with the same type of pre-dementia or early memory loss older adults, where we were doing brain scans in the living brain of plaque burden, tangle burden. And again, we were showing that levels of plaques and tangles, which correlate with cognitive function, plaques and tangles are seen to be lower in early dementia states for those, especially for mild cognitive impairment, where those who have a normalized body mass index versus an above normal, for those who have higher physical activity versus those with lower activity, their plaque and tangle loads are lower in the MCI population, the mild cognitive impairment. And for diet, the effect is even more across the board. Any individual, I would say at any age, but in our study population, kind of age 50 plus, whether you just have subjective memory change, so the earliest concept that my memory is not as strong as it was, or mild cognitive impairment, where you have deficits on memory testing, we showed with the green bars, those who are more highly adherent to a Mediterranean style diet had a green bar lower burdens of plaques and tangles, both with normal aging, which is the kind of benign forgetfulness, and also mild cognitive impairment. And that's compared to people who are reporting that they are not following Mediterranean style diet. And so this data that we had in individuals that were brain imaging, doing memory testing, is in agreement with the April 13th report I just showed you, which is EPI study, and also other prior studies showing Mediterranean style diet associated with lower rates of cognitive decline, decrease of Alzheimer's, especially when combined with the physical exercise with regularity. How is this happening? So there's both, this is a little complicated, which was I'm recommending you get a copy of these slides and you can take a look at them and digest them, no pun intended. They're both metabolic and molecular mechanisms. So systemic physiologic metabolic changes with the Mediterranean style diet. That, by the way, they don't just benefit your brain, they benefit your skin, your kidneys, your heart, the whole package. So the metabolic effects of that type of diet is you're reducing fatty acids, you're reducing caloric intake altogether, you're increasing the phytonutrients, kind of a plant forward diet, if you've heard of that. This is improving the molecular mechanisms of the body, where lipids are optimizing, your insulin sensitivity is improving, which normalizes blood sugar levels. That tends to lower inflammation, improve immune system function, and help the expression of your genome to be pro-longevity and healthy. So it's kind of essentially anti-Alzheimer's, also anti-carcinogenic. It's just a good way to live, very healthy. And so what does this look like? A picture is worth 1,000 words. So here we have fruits and vegetables emphasized in the Mediterranean style diet. And this is actually not Mediterranean. This is basically from the cardiac care literature. They just gave out dietary guidance to improve cardiovascular health. And lo and behold, it's the same thing. So what helps the heart helps the brain. Fruits and vegetables, if you're into that sort of thing, whole grains, proteins, this is a whole more talks about sources of foods and types of foods, but you're minimizing processed. This is kind of the obvious stuff, especially for Southern California, but it's good to know that the evidence is there. So jumping ahead to our center, our clinic, some of the clients you might see, forgive me, it's a lot of information. So this busy slide is just showing, like, what if we just do standard of care, treatment as usual with Alzheimer's? It's a brutal disorder. Over 5 years, you'll get up to 35% or more volume loss of the memory centers of the brain. This is just as like, I'm sorry to tell you, you have Alzheimer's, there's nothing you can do. Come back in 5 years, we'll confirm that. That doesn't work. So what we try to do with people is join with them. It's a brutal disease, and I'll get to in a minute. Not all cases can be slowed or stopped. We're still seeing progression. We're still seeing people have very difficult journeys with progressive Alzheimer's and dying. But sometimes, some cases, we hit the nail on the head and we're able to optimize health to improve brain function, and we see stability. We see preservation of hippocampal volume. We see sometimes even growth of those new brain cells that are born. There's more of them. People's cognitive performance is getting a little better. The brain volumes are looking better. I'm sorry, I didn't get to explain. So the dot represents how big somebody's hippocampus is. Over about 1.5 years for this, not this individual, but an individual like that one, when we re-imaged the brain, we actually saw growth. This is not supposed to happen. So somebody's going from 70 to 71.5, and their brain memory center has gotten bigger. That's like, stop the presses. We're all supposed to kind of follow this regression line, which is the solid line, which is, if you know about regression, it's the average or the mean. And over the years, we kind of expect a normal age-related decline of 1 or 2% brain shrinkage every year. With Alzheimer's, it's 3 or 4% shrinkage every year. And so what we're seeing, though, is people take better care of their health, and lo and behold, over time, they level off. So they plateau, they're able to maintain brain volumes, maintain brain function. And this is done through this powerful combination of foundational healthy lifestyle, which is, it's common sense. We know we need to get sleep. We know we need to eat well and not be too stressed and exercise, but it's having a coach, having a therapist to be not just held accountable, but also to join with and partner and empower people to exercise and eat in ways that are supportive of health, to not have habits like smoking or excessive drinking. So there's that lifestyle part, which you as a therapist are key. And then there's the targeted health in terms of precision medicine, where more and more doctors every day, there's another doctor's like, maybe the hormone replacement impacts the brain. Maybe metabolic health impacts the brain. Maybe systemic with COVID. You saw like the systemic infectious disease with inflammation and immune function, long COVID impacting the brain. So there's more and more appreciation that health optimization through medicine, preventive approaches, and then also preservation approaches can help optimize brain function to reduce progression of dementia. Getting into the weeds a little bit, just as a controversial example. So there was the Women's Health Initiative. Oh my gosh, we got to get everybody off estrogen. My, oh my, that's very dangerous. So when you take estrogen away from the brain, it's not happy. The cells shrink. There is dysfunction. These are the mitochondria. Mitochondria produce energy in the cell. When you take estrogen away, especially, this is a graph of like if somebody needs to have their ovaries removed for cancer risk or some reason, the mitochondria shrivel up. They don't function as well. There's not as much neurotransmission. These are the neurotransmitters going from presynaptic to postsynaptic. The area of the synapse, which is the area where the two cells communicate with each other, gets smaller. And we see that this relates to worsening working memory, which is one of the initial like cardinal symptoms of Alzheimer's, not being able to remember something. So taking the supportive effect of estrogen away from the brain is damaging for brain health. It's difficult. So there is a risk benefit. So things like cancer risk, other risks of estrogen replacement have to be discussed and taken into account. You can't just give hormone therapy to everyone, but this is a basic science example of how systemic hormonal impact can relate to changes both in brain cell function and then also production of amyloid. So again, amyloid is the pathology that defines Alzheimer's disease, amyloid plaque. With estrogen, amyloid precursor remains soluble. It doesn't form these plaques. Without estrogen, we see a lot more of the amyloid plaques. So women get exposure to living with no estrogen postmenopausally, unless there's like hormone replacement intervention, which I'm a psychiatrist, I'm not a gynecologist, I'm not a specialist. So in a way, I'm getting out of my lane, but that's why I work collaboratively. So primary care doctors, gynecologists, functional medicine doctors who can have that risk benefit discussion with the patient, with the loved one. You can decide what's your relative risk. Do you have a strong family history? Have you had earlier onset Alzheimer's with the ApoE genotype? Sorry, I'm kind of rushing, but it's just the kind of nuance that's not estrogen for everyone, but this is the enemy in the room for my world as a geriatric psychiatrist. Dr. Dale Bredesen, who's been kind of a pioneer in this kind of functional medicine world of optimizing health, he likes to say like, it's playing chess with the devil. So if you're going to lose, it's like eternal damnation. So it's kind of like a bad outcome. So sometimes you might want to take more risk to go down the normal aging pathway versus the abnormal. And so it's just really a matter of like balancing the risks and benefits. And so hormone replacement is one controversial, difficult example. His whole premise, Dr. Bredesen, is to assess the health, optimize health, and repeat. We now know there's 36 or more health factors, 36 so-called modifiable risk factors that can lead to stress for the brain and worse outcomes for brain aging. And so these fall into categories like inflammatory effects, metabolic effects, nutrient-related effects, growth factors, hormones, environmental toxins. So to find these problems, you have to look, you have to be curious. People have to learn about themselves, their health. They can identify what's a stressor for them, what's not a stressor for them. Some people, they only have 2 problems. Other people, they have 20 problems. So it's trying to identify proactively how to optimize your health and then live better longer. Normally, if I was with somebody in a room, I would stop and would probably discuss questions. Pressing on. Over the pandemic, it was very difficult because all of a sudden nobody could come in the office. We were all shut in our houses. And we know that isolation, social isolation actually raises the risk of dementia. So and it may do through things like systemic inflammation, may be one of the drivers. So I started tinkering. We started doing pilot groups. We had a not just one, but we had several pilot pandemic groups over Zoom. This one in particular was a health educator and doctor co-led group. We had a nutritionist, Amy Lee Amos, and also a brain health coach, Ryan Glatt, with myself and a nurse practitioner I work with closely, Claudia. We met every week for 6 months with a small group of patients. And we were going through, they were all very interested in Bredesen. So we were using Amy Lee's Amos Institute online course, which is a health education course. We were combining that with my health optimization in clinic, where we're checking some lab markers, working with primary care to then try to optimize health. And what we found was that as we met every week with people, with clients and families and providers and health coaches, all those encounters that we had, they helped develop our knowledge. So they helped develop my knowledge, they helped develop the client's knowledge, they helped develop the health educator's knowledge. Every interface was this point where there's a chance to increase your body of knowledge. Hopefully, with the microphones working and you have a good internet connection, hopefully some of your knowledge development is happening. And that's why part of why I want to finish, so I can hear from you and help my knowledge base develop. And so that's why the importance of frequency. It's like, oh, I just need to see you once every 3 months. How can you develop your knowledge unless you're talking, meeting? It's like the FIT principle: frequency, intensity. What's the other one? Time. Anyways, so we saw this happening in real time. And how do we measure it? Well, we did memory testing over the computer. People actually did this on the web from their homes. And we saw that spatial planning, verbal reasoning, even global cognition was able to be improved in these early pre-dementia cases through healthy lifestyle reinforcement, health optimization. We were moving the needle for them. We were flattening or plateauing their progression into where they were not only staying stable, some of them were actually improving. So that's on the microscopic case-based level. And you can do this with some of your clients if they've got, them willing, and you can learn for yourself as well. You can help your health improvement. I have to say, through that group, I was actually able to increase my exercise levels. I think I increased my adherence to the Mediterranean style diet. It's not one size fits all, but it's kind of these concepts of some people want to swim, some people want to hike, some people want to play pickleball, some people can't, so they have to do chair aerobics. So it's not one size fits all, but the premise is the same, and you can share and join together about it. A few words about I promised this, the Lancet Commission came out with now 12 modifiable risk factors that can account for 40% or so of dementia cases could potentially be prevented or delayed by reducing or eliminating this risk factor in individuals. And we know some of the risk factors. A few things pop out as surprising. So we know about education being important, cognitive reserve. To me, hearing loss was surprising. 8% attributable risk. That's why I know when you do Zoom with people, with clients, they have to be able to hear. So you kind of address that through your Zoom platform. But it's underappreciated what risk that sensory deprivation puts you at for the brain as you get older. I think that's actually the largest attributable risk is hearing loss. So the other factors there, I'll get you the slide, you can read them. Things you're familiar with, we've been talking about: blood pressure, excessive drinking, smoking, social isolation, physical activity. Diet relates to a lot of these. In fact, there's a slide next, kind of bins these into, I think the upper one would be kind of your collaborate with your healthcare provider to make sure you're not having diabetes, high blood pressure, that you're working on things like your body composition. And the lower ones relate more to lifestyle behaviors and how, as a therapist, can you reinforce, making healthy choices and making things that benefit somebody and getting them to kind of take care of themselves. So like treat hearing impairment, get out there, be proactive socially, engage in lifelong learning. And so the mechanisms are what we've been reviewing. So reduce pathology, increase brain function through improvement in brain structure, so increasing your cognitive reserve, And ultimately, where do we end up? Hopefully we end up preventing dementia. So if there's this Alzheimer's continuum, the best case scenario is that somebody actually swims upstream and goes back towards preclinical or no Alzheimer's. But if you find somebody, you join with somebody at any point in this spectrum, the hope is to kind of stall progression and improve their quality of life through adjoining education with them and their loved ones to where they don't progress into moderate severe, where the symptoms are so bad they have to be placed out of their home, or they're just no longer to have a quality of life. And now we know that there's so much that can be done to help increase the health span and optimize brain health over time, and try to achieve as much optimal longevity as possible for the individual. So this is what I do day in, day out. That's why I send people to Cognitive Care Solutions. Allison matches them up with you guys as care providers and therapists. And you guys should all be on this slide as well. This is our Brain Health Center team. It takes a village. This has not happened overnight. I was an overnight success in 30 years. That's what they like to say. So I always do want to thank everybody that I'm working with. Neurologists, Dr. Porter is our main neurologist. We have nurse practitioners, Claudia and Mihei. I don't know, some of you may know them. We have a lot of health coaches like Ryan, and research staff, behind the scenes, front desk, medical assistants, research consultants. So I always want to be thankful of the team that I'm on, and I consider y'all as part of the team joining together here today. So I want to stop my yabbering on and leave time for you guys to talk to me and ask you any questions you might have.